Your doctor is recommending cataract surgery, but what does the day of the surgery look like? In this episode of OCuTALK, ophthalmologist Heather Chen walks us through the process, including the presurgical protocol, the procedure itself, and the post-operative care. Dr. Chen? Hello, and welcome to OCuTALK. Today, we're going to be discussing the topic of cataract surgery with Heather Chen, MD. Dr. Chen, welcome.
Hi, thank you for having me.
Before we get started, would you mind telling our audience a little bit about yourself and your background and specialty?
Sure. So I grew up in Southern California and I haven't really traveled far for my training. I went to UC San Diego for medical school and for residency. And then afterwards, I joined the practice I'm currently in, Grider Eye Associates, up in North County, San Diego, where I've been for the past 3 years. I'm a comprehensive ophthalmologist, so I mostly focus on cataracts and glaucoma, but I also treat dry eyes and diagnose patients with retinal diseases.
Well, that is perfect because, as I mentioned, today we're going to talk about cataract surgery. To get our audience started, what exactly is cataracts?
So cataract is a clouding of your natural intraocular crystalline lens. We're all born with a lens that is clear, but that can slowly become opaque as we get older. And your natural lens is responsible for 1/3 of the focusing power of the eye. So as the cataract progresses, it can affect the optical quality of the lens and then cause a decrease in vision over time.
So now what can be done to address the cataracts once diagnosed?
So unfortunately, there's no, pill or eye drop that can slow down the progression of cataracts. The real solution is ultimately cataract surgery, where we take out the cataract and put in an artificial lens implant in its place. But luckily, cataract surgery is generally very smooth and straightforward, and the recovery time is very fast. So it's a very easy solution to the problem.
So how soon after the diagnosis do you schedule the actual surgery?
So this kind of depends on, your cataract surgeon and how their clinic operates. But in my clinic, once the patient and I've decided that the cataract is visually significant and they're ready to proceed with surgery, then I notify my surgery schedulers and we obtain any insurance authorizations that are necessary. The wait time varies depending on, the availability of your surgeon's operating schedule and whether or not you have any other medical issues that could prevent you from having outpatient surgery. But if you don't have those issues, in my clinic, we schedule about a month out from when I evaluate the patient. So the wait is not too long generally.
So what is your pre-surgical regimen? What happens between when you schedule the surgery and the first day or the day that they come in for the surgery?
Yes, sometimes the preparation for the surgery takes longer than the actual surgery itself. Generally, your surgeon just wants to make absolutely sure that they have all their lens calculations correct and everything that you want to have in terms of your surgical outcome. So, depending on what lens implant the patient and I have decided to use, the patient may need to return to the clinic for a few quick measurements of their eye shape with my technician to help with surgical planning and make sure that we're choosing the correct lens. And then oftentimes the patients will have a pre-operative appointment with one of my technicians who will go over a couple things. They'll go over the consent forms, they'll go over pre-operative and post-operative instructions. They'll tell you things like what medications you're going to take, what medications to take and not take the day of surgery, how you use your eye drops after surgery, the location of the surgery center, how to check in. They kind of go over all those logistics. We also tell patients generally to clean their eyelids, either with OCuSoft lid products or something similar, for a few days before the surgery, just to decrease the bacterial load on their eyelid margin.
How do you choose which lens to use?
So that definitely kind of varies based on the patient and their goals. And I know this is a long discussion that's been covered, in another OCuTalk. But basically, I go over kind of with my patient what their refractive goal is after the surgery based on their lifestyle and what they enjoy doing. I do offer multifocal lenses and astigmatism correcting lenses that can decrease their reliance on glasses after surgery, but no lens is perfect. And sometimes patients have other conditions in their eye that steer me away from offering those premium lenses. But of course, I always also offer basic or standard lens implants covered by insurance, but just counseling the patients that they would have to wear glasses after surgery.
Okay, so it's the day of my cataract surgery. Can you tell us what that looks like? Walk us through.
Yes. So the day of surgery, and this may kind of vary depending on your surgeon and where they do their surgery, but we do our surgery at a nearby local outpatient ambulatory surgery center where the nurses are very kind of well versed in cataract surgery. So they do this day in, day out. Usually arrive an hour to an hour and a half before your scheduled start time to get ample time to get ready. When you check in, they have you change into a hospital gown. The nurses check your vital signs and they start putting eye drops in your eye to keep the eye numb and start dilating your pupil so your cataract surgeon can operate on the cataract. There might be some more paperwork to fill out. There's lots of confirming which eye they're working on because no one wants to make a mistake there. And then they'll have you kind of lay down in the hospital bed and they'll place an IV so that your anesthesia provider can have access to give you twilight sedation during the surgery. And then your surgery team, your anesthesiologist, your surgeon, the nurses will all say hello. They'll talk to you and answer any questions you have the day of surgery. And it's important to know that the day of surgery, you do need someone to accompany you so that they can take you home because it's not safe for you to drive with the twilight sedation.
So now can you walk us through the actual surgery? How does that work?
So cataract surgery is usually quick and painless, taking 30 minutes or less. You'll be laying flat so that the surgeon can operate over you with a microscope overhead. The nurse will clean your eyelids to prepare you for the surgery, and they place a drape over the sterile area. Then your surgeon puts in a lid speculum, a little metal piece to kind of keep your eyelid open so you don't have to worry about blinking and that kind of thing during the surgery. Then the surgeon takes out the cataract and replaces it with a new lens implant. This entire time you'll have twilight sedation and numbing in the eye, so you should be pretty relaxed and comfortable. You may not remember much at all. But some patients have told me that they see some bright lights from the microscope or feel some cold water over the eye. But really, that's about it. The surgeon and the anesthesia provider should be keeping you comfortable and pain-free. That's about it.
What about right after the surgery? What is the post-surgical regimen like?
After surgery, kind of you go to the recovery area, and then when you're feeling up and ready, you can go home that day. It's normal that day for the eye to feel a little bit, scratchy or sore, but that usually goes away by the end of the first day. And by the next morning, when you see your surgeon in clinic, most people are pain-free and they're already seeing better than before.
So what about the longer term post-surgical regimen? Is there anything that the patients need to know about going home afterwards?
Yes, so we go over those instructions at the surgery center, but generally we have patients start their eye drops when they go home. The eye drops are up to 4 times a day, and we keep an eye shield over the eye. Otherwise, just kind of keep it protected and remind you not to rub the eye. But I would say the surgery restrictions for after surgery are not as restrictive as kind of some bigger surgeries. The main things to avoid are excessively rubbing the eye, splashing water in the eye, bending over with the head below the heart, or kind of lifting heavy weights. These are things that kind of sometimes or very rarely can increase the risk of the lens implant moving or increase your risk of infection. But honestly, that risk is pretty rare. So the restrictions are pretty mild overall, and it varies based on the surgeons. I would say the first 2 or 3 days after surgery, that is the most important. Your surgeon may tell you to continue those restrictions for 2 weeks. That's what I do generally.
So after 2 weeks, are we fully healed? Is that the recovery time frame?
Yeah, I would say for me, the restrictions are there for 2 weeks, and afterwards, I allow people to do any exercises or activities that they would like. In terms of the eye healing, um, some patients see clear, 1 day after surgery, and others it might take up to a week for inflammation and swelling in the front of the eye to heal. So I always counsel patients, that it could take 1 to 2 weeks for your vision to fully improve. And we generally wait about 1 month after the surgery before measuring you for new glasses. But oftentimes the visual improvement that people notice is pretty dramatic within the first week.
Well, that sounds pretty amazing. So after the cataract surgery is done, how soon before your patients need to come back and do a follow-up visit with you?
So I generally see them 1 day after the surgery, 1 week after the surgery, and they also see my optometrist for a final checkup 1 month after the surgery.
So after cataract surgery, are we cured of cataracts? We never have to worry about it ever again? Or is it something that you need to continue to monitor?
Generally, the nice thing is that cataract surgery is one and done for the most part. Once the cataract is completely removed, it does not grow back, which is great. However, patients can develop a secondary membrane behind the lens implant called a posterior capsular opacity. This is where the clear capsular structure that holds the lens implant becomes opacified over time. This can occur weeks to months to years after the surgery, and it's very common. But luckily, this can be quickly removed with a laser procedure in the clinic, and then that membrane doesn't grow back. So I always counsel my patients, you may have one final touch-up laser after the surgery, but the original cataract doesn't grow back, so you won't need cataract surgery twice in one eye.
So, what are any risks or side effects that you would want patients to know in advance going into cataract surgery?
Risks or side effects in advance. I would say, um, depending on what lens implant you would want in your eyes, different lens implants can come with different side effects. So some of the multifocal lenses can give you the most range in vision and the most glasses independence, but you can have a small sacrifice in contrast quality, and some people notice some glare at night. But it's usually not as bad as when the cataracts were originally in the eye. In terms of other risks, generally cataract surgery is pretty low risk. I would say over 90% of the time, the surgery is very successful and people see better than they do before the surgery. The other 10% of the time, if they are seeing the same or worse, it's usually due to predisposing risk factors like other conditions in their eye that limit their vision. So most people are very happy after cataract surgery.
So, what would happen if your patient declined to have the surgery altogether? What would the result be there?
So we do often monitor mild cataracts that don't interfere with the vision, and that's totally okay to do. I see some people once a year, and I say, "See you later. See you in a year. Your cataracts are slow growing." But once the cataract grows, and I feel that surgery would help, I do offer surgery to the patient, and patients can decline because it's an elective procedure. We never push anyone to do surgery, but I do tell them that the cataract will continue to progress and that they'll likely have worsening vision if they don't get the surgery.
Well, I think that sounds like wonderful advice. Is there anything else you want to tell our audience about cataract surgery or the day of the surgery or the process leading up to and following the surgery? Any other helpful information you want to give?
I would just say my whole goal for today's talk was to dispel any myths that cataract surgery is this big, scary surgery. It's actually the most common surgery done worldwide with, extremely high success rates and very low kind of risk profile. It's definitely the most gratifying part of my job because patients can see better within 24 hours after a quick 20-minute procedure. And obviously I'm biased, but I feel like almost nowhere else in medicine can surgery provide that kind of immediate gratification. And so I'm just hoping, patients who are afraid to have surgery or feeling apprehensive can listen to this talk and feel, more prepared and comfortable with proceeding with cataract surgery in the future.
Well, I think you definitely accomplished that goal because you made it sound super easy and efficient. So thank you very much for sharing all of that information, Dr. Chen. Is there anything else you would like to tell our audience today?
No, I think that's it.
All right. Well, wonderful. Thank you so much for joining us.
Thank you. Thank you for having me.